Contact with our leader, Mark Levin.
Hello, my friends. We're going straight to the press conference. President Barack Obama.
No insurance company will be allowed to deny you coverage because of a pre-existing medical condition. I've also pledged that health insurance reform will not add to our deficit over the next decade, and I mean it. In the past 8 years, we saw the enactment of 2 tax cuts, primarily for the wealthiest Americans, and a Medicare prescription program, none of which were paid for. And that's partly why I inherited a $1.3 trillion deficit.
Terrible.
That will not happen with health insurance reform.
No, we'll spend
it will
$12
be
trillion
paid for.
deficit. Right.
Already we've estimated that 2/3 of the cost of reform can be paid for by reallocating money that is simply being wasted in federal health care programs.
That is a lie.
This includes over $100 billion of unwarranted subsidies that go to insurance companies as part of Medicare. Subsidies that do nothing to improve care for our seniors. And I'm pleased that Congress has already embraced these proposals.
Get them. Get those
While
insurance
they're currently
companies. Get
working
'em.
through proposals to finance the remaining costs, I continue to insist that health reform not be paid for on the backs of middle-class families.
Oh.
In addition to making sure that this plan doesn't add to the deficit in the short term, the bill I sign must also slow the growth of health care costs in the long run.
Rationing.
Our proposals would change incentives so that doctors and nurses are free to give patients the best care, just not the most expensive care.
Oh.
That's why the nation's largest organizations representing doctors and nurses have embraced our plan.
Oh. Special interest.
We also want to create an independent group of doctors and medical experts who are empowered to eliminate waste and inefficiency in Medicare on an annual basis.
This is the Politburo.
A proposal that could save even more money and ensure long-term financial health for Medicare. Overall, our proposals will improve the quality of care for our seniors and save them thousands of dollars on prescription drugs, which is why the AARP has endorsed our reform efforts.
No, they did it because they're
Not
left-wing.
all of the cost savings measures I just mentioned were contained in Congress's draft legislation.
They're
But
non-existent.
we're now seeing broad agreement thanks to the work that has been done over the last few days. So even though we still have a few issues to work out,
I thought this was
what's
a press
remarkable
conference.
at this point is not how far we have left to go. It's how far we've already come.
Oh, good spin.
I understand how easy it is for this town to become consumed in the game of politics, to turn every issue into a running
You own
tally of
this
who's
town.
up and
Your
who's
party
down.
owns it.
I've heard that one Republican strategist told his party that even though they may want to compromise, it's better politics to go for the kill.
Amen.
Another Republican senator that defeating health care reform is about breaking me.
Yes.
So let me be clear. This isn't about me.
Yes,
I
it
have
is.
great health insurance, and so does every member of Congress. This debate is about the letters I read when I sit in the Oval Office every day.
Oh,
The
really?
stories I hear at town hall meetings. This is about the woman in Colorado who paid $700 a month to her insurance company, only to find out that they wouldn't pay a dime for her cancer treatment, who had to use up her retirement funds to save her own life. This is about the middle-class college graduate from Maryland,
Grievances,
whose health insurance
pretexts.
expired when he changed jobs and woke up from the emergency surgery that he required with $10,000 worth of debt. This is about every family, every business, and every taxpayer who continues to shoulder the burden
Trillions
of a
and
problem that
trillions in
Washington
debt.
has
Who's
failed
gonna
to
pay
solve
for that?
For
Who?
decades. This debate is not a game for these Americans, and they can't afford to wait any longer for reform.
No. No, have to
They're counting on us to get this done. They're looking to us for leadership, and we can't let them down.
So try and
We will
provide
pass
some.
reform that lowers cost, promotes choice, and provides coverage that every American can count on. And
Oh,
we will
crap.
do it this year.
Oh.
With that, I'll take your questions.
Yes,
And
Commander
we
Hugo
are going
Chavez.
to start off with Ben Feller at Associated Press.
Associated Press. Here we go.
Thank you, Mr. President. Congress, as you alluded to, is trying to figure out how to pay for all of this reform. Have you told House and Senate leaders which of their ideas are acceptable to you? If so, are you willing to share that stand of yours with the American people? And if you haven't given that kind of direction to congressional leaders, are you willing to explain why you're not stepping in to get a deal done, since you're the one setting a deadline?
Well,
Not bad.
before we talk about how to pay for it, let's talk about what exactly needs to be done. And the reason I want to emphasize this is because there's been a lot of misinformation out there.
Why don't you tell us how you're going
Right
to pay for it?
now, premiums for families that have health insurance have doubled
Here we go.
over the last 10 years. They've gone up 3 times faster than wages. So what we know
The
is
deficit
that
is quadrupled
if the
in
current
6
trends
months.
continue, more and more families are going to lose health care. More and more families are going to be in a position where they keep their
How are
health
you
care.
going to pay for your plan? Answer the question.
Employers are going to put more and more of the costs on the employees, or they're just going to stop providing health care altogether. We also know that with health care inflation on the curve that it's on, we are guaranteed to see
How are you
Medicare
gonna
and
pay for
Medicaid basically break the federal budget. And we know that we're spending, on average, we here in the United States are spending about $6,000 more than other advanced countries where they're just as healthy.
No, they're not
And
just as
I've
healthy.
said this before. If you found out that your neighbor had gotten the same car for $6,000 less, you'd want to figure out how to get that deal. And that's what reform's all about. How can we make sure that we are getting the best bang for our health care dollar? Now, what we did very early on was say 2/3 of the costs of health care reform, which includes providing coverage for people who don't have it, making it more affordable for folks who do, and making sure that we're, over the long term,
what about the
creating the
2/3?
kinds of systems where prevention,
We're waiting.
wellness, and information technologies make the system more efficient, that the entire cost of that has to be paid for, and it's got to be deficit neutral. And we identified 2/3 of those costs to be paid for by tax dollars that are already being spent right now.
That's
Taxpayers
baloney.
already
The
put this
congressional
money into
budget, ladies and gentlemen,
The problem is they're not getting a good deal for the money
he
they're spending.
can't look straight
That
at you
takes
and give
care
you a
of about
straight
2/3
answer
of
because
the
he doesn't
cost.
have one.
The remaining 1/3 is what the argument has been about of late. What I've said is that there may be a number of different ways to raise money. I put forward what I thought was the best proposal, which was to limit
Yes,
the
cut
deductions,
mortgage
the itemized
deductions, charitable deductions.
for the wealthiest Americans. People like
welfare.
myself could take the same percentage deduction that middle-class families do, and that would raise sufficient funds for that final 1/3.
No, it wouldn't, as a matter of fact.
So far, we haven't seen any of the bills adopt that. There are other ideas that are out there. I continue to think my idea is the best one.
We heard this 6 weeks
But
ago.
I'm not foreclosing some of these other ideas as the committees are working them through. The one commitment that I've been clear about is I don't want that final 1/3 of the cost of health care.
Okay. The 2/3 is not covered, folks. The
shouldered
final 1/3 he's talking
on the
about.
backs
How
of
come he's not
middle-class
telling the
families who are already
Democrats to do what he wants?
struggling in a difficult
Instead,
economy.
his mind is over.
And so if I see a proposal that is primarily funded through taxing middle-class families, I'm going to be opposed to that because I think there are better ideas to do it. Now, there are, I have not yet seen what the Senate Finance Committee is
He has
producing.
no answer.
They've got a number of ideas, but we haven't seen a final draft. The House
Was 5 minutes into his
suggested a
answer.
surcharge on wealthy Americans, and my understanding, although I haven't seen the final versions, is that there's been talk about making that basically only apply to
Rich.
families whose joint income is $1 million. To me, that meets my principle that it's not being shouldered by families who are already having a tough time. But what I want to do is to see what emerges from these committees, continuing to work to find more savings, because I actually think that it's possible for us to fund even more of this process through identifying waste in the system, try to narrow as much as possible the new revenue that's needed on the front end, and then see how we can piece this thing together in a way that's acceptable to both Democrats and I hope some Republicans. Absolutely, it's my job. I'm the president, and I think this has to get done.
So what do you
Just a broader
yes,
point.
that's the point.
If somebody told you that there is a plan out there that is guaranteed to double your health care costs over the next 10 years, that's guaranteed to result in more Americans losing their health care, and that is by far the biggest contributor to our federal deficit, I think most people would be opposed to that. Well, that's the status quo. That's what we have right now. So if we don't change, we can't expect a different result. And that's why I think this is so important.
Next question.
Not
That
only
one you blew. Next
for those
question.
families out there who are struggling,
Oh, for
and who need
God's
some
sakes.
protection from abuses in the insurance industry, or need some protection from skyrocketing costs.
Let's all go to the
But it's
Indian
also important for
reservations.
our
There it
economy.
is, Nirvana.